Well, good afternoon, everybody. My name is Dr. Rajiv Vyas, and I'm delighted to have been asked to give you this presentation. Today, I'd like to share with you strategies to decrease stress in your life and improve your well-being. So I have no financial interest or affiliation with the material presented today. Okay, so this is your imaginary stress reduction toolbox. So as I go through this presentation, think about stress reduction strategies that you want to put inside this toolbox so that when you're stressed, you can pull things out of this toolbox to restore balance in your life. You should put stress reduction strategies in this toolbox that you can use in moments of acute stress. And also you want to add strategies that you can use to reduce the general day-to-day level of stress and anxiety in your life. So our learning objectives for today are to define stress and its effects on our physical and mental health, to learn ways to decrease physical and mental stress, and understand the benefits of meditation and mindfulness. I'm part of the Capitol Health Behavioral Health Specialists. We have two offices, one in Bordentown, New Jersey, and in Newtown, Pennsylvania. Okay, so we're a group of psychiatrists, nurse practitioners, psychologists, therapists, nurses who provide diagnostic evaluations, medication management, TMS, a non-invasive technique helpful for some individuals with resistant depression, and various types of individual and group therapy. We offer both in-person and telehealth appointments. Okay, so now take a moment to think about what kinds of things are stressful in your life right now and how you're handling them. Managing our stress is a lifelong journey and an ongoing journey toward wellness. Your stresses and my stresses may be unique, but there are evidence-informed and evidence-based strategies that you can use to reduce stress and increase wellness. You may have already developed some strategies to de-stress, but I think you'll also find some others in this presentation useful. So my goal is that in this talk, this will spark a renewed interest and commitment to make changes that you might have been putting off. Although I'm the presenter and you're the participant, we're all in this journey together. I was reminded the other day by my son, who said, "Dad, how come you get such little sleep?" I was caught off guard, and defensively, I told him, "I'd love to get more sleep, but I have too much to do." And later that evening, I reflected on what my son had said and realized he was right. I do need to make a commitment to get more rest. So we're all beginners in this journey to manage stress. This is my challenge to you. Pick some things that resonate with you in this talk, put them in your toolbox, and start using them for a less stressed you. Okay, I want to jump right into reducing stress with a short, deep breathing exercise. The mind and the body are often disconnected, and the breath brings them into connection. Our mind is often stuck in past regrets and future worries. Rarely do we find ourselves in the present moment, which is, when you think about it, the only moment that really exists. So what we'll be doing is we'll take 5 deep abdominal breaths. Abdominal breathing is the way babies breathe. Over time, as we get to be adults, we forget how to breathe in a deep way like this. Most of our breathing occurs in our chest and is shallow. So now, if you're comfortable, close your eyes, and let's do this abdominal breathing. So, okay. So I'm going to lead you through it. Watch your abdomen rise on the inhalation and fall on the exhalation. Let's do that again. See how the belly rises on the inhalation and falls on the exhalation. Now I'm going to let you do this 4 or 5 times on your own. Okay, so I think you may be done at this point. So, um, this is a very powerful technique. The other day, if I have a smartwatch like many of you, and it was telling me that my heart rate was, had gone up like 20 points or something. And so I did this deep breathing exercise, these 5 abdominal breaths, and wouldn't you know it, within a minute, my heart rate had gone back down to in its normal range. Some people make a commitment to do something like this every hour, and we can easily set our smartphones or our smartwatches with reminders for this. So you can do it every hour, or you can just look at an old-fashioned clock. Okay. So I want to share with you another really powerful technique. It's called box breathing, or sometimes called square breathing. It's another relaxation technique that you can use when you're feeling stressed and anxious. Okay, so let me guide you through this. So we want to start by, I'll just explain it to you, and then we'll do it. We're going to do we're taking a deep breath, and we're going to breathe through our nose for 4 seconds. We're going to hold the breath for 4 seconds without exhaling or inhaling. And then we're going to exhale slowly through our mouth for 4 seconds and then hold for 4 seconds. And we're going to repeat this cycle. So if you have that, I'm going to guide you through that. Okay, so let's start. And I'm going to do the counting for you. Okay, hold. 1, 2, 3, 4. Let's try that again. Let's do this first. I'm sorry. We're gonna just start by taking a deep breath through your nose for 4 seconds. So let's start. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Hold. 1, 2, 3, 4. So you can try this technique on your own. It's pretty straightforward, and you can, if some people have difficulty holding for 4 seconds, you can hold it for 2 or 3 seconds if that's easier for you, until you can do it for 4 seconds after a time. Okay. And now I want to share with you yet another technique. So what I've shared with you is the abdominal breathing and the box breathing. These are things that you can use when you're feeling stress in the moment, the acute stress. And here's another technique when you're feeling stress in the moment and realize that you need to be more relaxed. So this is the 5 senses grounding technique for stress reduction. It's a pretty common technique. Some of you who've been have engaged in kind of psychotherapy, often therapists use this to help that person kind of get back into the present moment. And it's and it takes your mind away from anxious thoughts and worry. So we're gonna first of all look around you. Now I want you to notice 5 things around you. Look at the shape, color, etc. of the things that you see. 5 things, any 5 things. I'm looking at chairs in my office. I'm looking at a lamp. I'm looking at a coat. So look at 5 things around you. Now I want you to listen for 4 different sounds in your environment. It could be, I don't know, the sound of a car passing outside, perhaps. Maybe the gentle whir of your computer. Maybe people talking in kind of outside wherever you are. So try to listen for 4 different sounds. Now I want you to touch three things and you kind of in your mind describe the texture and shape in your mind of three things. I see a mouse pad that I'm touching. You can touch your, for example, the clothing um, on you. You can touch anything in your environment. So touch three things. I want you to now smell two things. Now, there might not be any kind of scent or anything in your room or where you are at. Um, but if not, just kind of just, you know, take in the air and smell that air. You might even be able to smell your shirt if, or if you wear any kind of perfume, you can maybe smell that. So the last thing I want you to do is to, if there's, you may not have any food around you, but if there is, you can certainly taste that food. Um, if you don't have anything, sometimes just like taking your tongue around the inside of your mouth and tasting that. Sometimes there's something that's been left over from lunch or something like that you can taste, or just even the saliva in your mouth. So these are all things that you can do. And so this is the five senses grounding technique. So what I've described are three very quick techniques that you could do in the moment, and you can even do them in succession if you want, or pick any one you want, um, um, and use that when you're stressed. So, okay. So what is stress? Stress is a bodily or mental tension resulting from factors that tend to alter an existing equilibrium. That's what Merriam-Webster says. That's a mouthful. Um, but let me give you an example to drive home the point of what stress is. Imagine you're going to work in the morning and you're stopped at a red light and suddenly you're hit from behind by another car. What you've experienced is a disturbance in your equilibrium. That is the stress, and then this is stress. And how you respond to it can make all the difference between the amount of stress and your body and mind will experience. You can get out of the car angry, let the other driver have a piece of your mind, or you can take a few deep breaths, like these abdominal breaths that we just did, and be thankful that no one was hurt and approach the other driver in a friendly manner. Our stress response system is complex, and we're certainly not going to go into any detail, but there's a number of interactions with the various systems in our body, such as the endocrine, immune, and nervous systems. Stress-related conditions affect all the major organs and may aggravate or precipitate illness and disease which may never have happened to you otherwise. And here's a list of some of the conditions. There are many more that are affected by stress. I want to explain to you the difference between acute stress and chronic stress. Acute stress is something that through evolution we've been able to cope with and handle better than chronic stress. Um, Acute stress may be something like being pulled over um, by an officer for speeding. Maybe, for example, having a project deadline at work, even a loss of a loved one or moving. These could be acute stresses. But chronic stress is entirely different. It's things such as financial hardship, your own health problems or of health problems and illness of somebody that you're caregiving for, maybe an unhealthy relationship. These are chronic stresses. And let me give you an example to illustrate this further and the damage that chronic stress can cause. Imagine you pour a bucket of water onto the ground, and now with time, that water will dry up. But now imagine a steady trickle of water on the ground. Not only will the ground not dry up, but in time you may have a veritable pond of water. So this is the analogy between acute stress and chronic stress. So sometimes we're not even aware that we're stressed, but there are signs. And if we are attuned to it, we will know that something is wrong. We may have experienced difficulty sleeping, for example. This is one of the most common complaints I get from my patients. Um, Spouse or family members may share with you that you're more angry, irritable, um, and they may share that with you. You may be consumed with thoughts or images of worry that may impact your daily activities at home, or you may find yourself having difficulty concentrating at work. And some people sadly turn to alcohol or cannabis when stressed, and this invites further problems down the road. It may seem like a temporary fix, um, but it generally causes more harm than good. So about 2/3 of the visits for primary care may be for stress-related conditions. Aging itself can increase the stress hormone cortisol, adding insult to injury. So cortisol is associated with poor cognitive performance and shrinkage of areas of the brain associated with memory. So now we're going to go into some strategies to reduce stress on a physical level. And there are a number of them. And so we're going to just dive right into that. Let's talk about sleep. Um, the importance of sleep. This is one of the first things that you can do in terms of physical things you can do to reduce stress. The American Academy of Sleep Medicine recommends 7 or more hours of sleep for adults. The American Heart Association has even added adequate sleep as one of the 8 essential ingredients of heart health. Sadly, 1 in 3 adults doesn't get enough sleep. 2 recent studies indicate that during sleep, the brain processes and stores new information. Catching up on sleep helps some, but consistent sleep is better. And lack of sleep is associated with the increased risk for dementia, diabetes, obesity, heart disease, stroke. So a number of very important conditions and prevalent conditions that can be affected by sleep. So some of us pride ourselves in how little sleep they believe they need to function. It's almost like a badge of honor, but it may be at the price of bringing on a worsening disease. Memories are consolidated during sleep, as I mentioned, and a good night's sleep helps you be more focused and alert during the day. As we age, we tend to sleep less, so seniors have to make an even greater effort to get enough sleep. Use of over-the-counter or prescription sleep medications should generally be limited to short-term use because they can impact memory and cognitive functioning. Sleep aids that contain diphenhydramine, such as Benadryl, ZzzQuil, Tylenol PM, and others, or other agents with anticholinergic properties, such as some tricyclics, antidepressants such as Elavil, etc., Flexeril, cyclobenzaprine for muscle spasms, Ditropana, and Vesicare, some things that may be used for an overactive bladder, may increase the risk of dementia with long-term use. So a study published in JAMA Internal Medicine 2019 involving 3,400 individuals aged 65 and over showed that those taking anticholinergic medications for 3 or more years had a 54% increased risk for dementia. So anticholinergic agents block acetylcholine, which is an important substance associated with transmission of messages within the nervous system. Also, sleep medications increase the risk for falls by as much as 50%, which could lead to head trauma that could increase the risk for dementia. In a large study, seniors on long-term anticholinergic medications had up to a 30% increased chance for dementia. So it's important to treat, and it's also important to treat obstructive sleep apnea because untreated sleep apnea can also impact cognitive functioning. Chronic stress can lead to behaviors which indirectly increase the risk to the heart and the cardiovascular system. Stress leads to inflammation that can increase blood pressure and the bad lipids such as cholesterol and triglycerides. And the risk for heart disease, heart attack, and stroke are increased by chronic stress and chronic inflammation. We used to think that the type A personality, the competitive, aggressive personality, was the one that was more uh, prone to heart-related problems. But now we believe that type D, disconnected, negative, and angry personality, may be at a greater risk. So practicing mindfulness, which we'll talk about a little bit later, uh, is helpful for these individuals to be more accepting and respond more calmly. Well, the second thing, physical thing that we can do, we talked about sleep, is exercise. Well, exercise is almost always topping the list of things we can do to improve physical and mental health. And no wonder, because of its broad impact on health. It can improve your sleep, it can reduce tension, boost your immune response, lower your bad lipids, improve your insulin efficiency. So, not to speak of the boost in your confidence and self-esteem when you exercise regularly. Studies also indicate that exercise has an antidepressant effect perhaps by activating the serotonin neurotransmitter, which has a role in regulating mood. Those engaging in exercise had drops in their depression rating. And as you may know, one of the most commonly prescribed antidepressant types of medication is the ones that increase serotonin levels in the brain, the SSRIs. Um, What, um, but you may also be surprised to hear that yoga has benefits similar to exercise, and in some cases greater when it comes to physical and mental health. Not only can it improve flexibility and balance, but it can decrease stress and anxiety and improve your mood. There are also studies that have found that it has cardiovascular benefits on blood pressure, lipids, and blood sugar levels. We believe one of the reasons is that yoga activates the parasympathetic nervous system, our rest and digest system, dampening down the effects of the sympathetic nervous system, which is our flight and flight system, fight or flight system that increases your heart rate, muscle tension, etc., as if you had um, something to be fearful of or some actual natural threat. Okay, so now let's talk about inflammation. This is a very important thing. The inflammation, the word inflammation and chronic inflammation, you've, I'm sure, heard it many times now. It's really very current and an important concept. And and I want to talk about acute inflammation versus chronic inflammation. We talked about acute stress, chronic stress. Now, this is also another tale of two cities. And acute inflammation may be actually very helpful in cutting down, for example, if you have a cut, it can clean up the debris in that area, promote new tissue growth, and so the scar heals. But chronic inflammation actually can cause cellular and tissue damage. So it can have the opposite effect. So chronic inflammation may contribute to chronic diseases like heart disease, diabetes, cancer, Alzheimer's, itis diseases like colitis and arthritis. Also alarming for us is that stress, aging, lack of exercise, poor sleep, and poor diet, those other things can also increase inflammation. So, it's a vicious cycle. Okay, so another thing we want to talk about on a physical basis that we can help improve stress. So, sometimes, you might feel kind of like, well, I wanted to reduce my stress, and that's like a mental thing. And how come Dr. Vyas is talking about all these physical things that we can do? Because it's the stress that you experience. If you can attack it from both a mental and physical perspective, your body as a whole uh, experiences less of the damage from chronic stress. So one of the things that can cause stress and inflammation is pro-inflammatory foods. These are all the foods on the no-no list that we all know about, the red processed meats, the highly refined carbohydrate foods, the sugary drinks, etc., um, saturated and trans fats. So these are the things that we want to avoid. And anti-inflammatory foods are also ones that we're pretty familiar with. It's what, everybody tells us to have, like the leafy green and colorful vegetables, whole fruits, not juices, whole fruits, whole grains, fatty fish, nuts can also be beneficial, and extra virgin olive oil. Coffee and tea, surprisingly, contain polyphenols, which have an anti-inflammatory property. And fermented fruits like probiotic yogurt or kefir can also be helpful. Now, anti-inflammatory foods may also promote a healthier, more diverse gut microbiome, the mix of microbes in your gut. There is some evidence that those individuals with a healthier microbiome from high fiber foods or and probiotic foods such as yogurt may actually live longer. Also, exercise may promote a microbiome diversity by reducing inflammation in the gut. So again, another benefit of exercise. Going back to that coffee and tea, surprisingly, there was a study of 340,000 individuals aged 50 to 74 who drank 2 to 3 cups of coffee or tea. They had a 32% lower risk of stroke. Okay, so the typical Western diet is all upside down. The recommended food pyramid, which should consist of a large base, the base of the pyramid coming from vegetable, fruits, and whole grains, and the smallest area, the top of the pyramid, meat, sugary, and high carbohydrate foods, etc. That is the ideal, but our diet is upside down, where it most closely resembles the diet that you see, the Western diet that you see, the pyramid on the right. Okay. All right. So there are, there's always different kinds of things, supplements and things like that people take to improve their health. And my in a sense, kind of caution to you is this, that most of the things that we can get over the counter that are touted for, which have various health benefits, actually may or may not, because these are not, the FDA does not regulate any of these supplements. And so they can say anything that they want, as long as they're not saying that they're going to cure a disease. So it can say something like supports brain health. Well, what does that really mean? They're not saying that it's going to help you with dementia. They're saying support brain health. So they don't have to have any evidence to point to it. But there are certain things that, I just want to quickly mention a few things. And that Ms. Rudolph said that in some other presentations, people have brought up questions about. So, for example, turmeric, the curcumin is the active ingredient in turmeric, and that is an anti-inflammatory. And sometimes that can be helpful for osteoarthritis and rheumatoid arthritis pain. You know, ginger, another thing, ginger supplements can aid digestion and can help with chronic inflammation, for example, in Crohn's, ulcerative colitis, rheumatoid arthritis, and psoriasis. So there's some evidence for that. None of these things are designed to replace the advice of your primary care clinician or doctor. Dark chocolate, there are a few things that actually are good for us and actually don't taste so bad. Just like the coffee and tea you might be used to having. It's dark chocolate. It contains flavonols, which have anti-inflammatory properties. In a study of 112,000 individuals, reported in 2024 showed that those people who had, 5 or more ounces of dark chocolate a week had a 21% decreased risk of developing dementia. So these are studies that indicate something. They're not necessarily double-blind controlled studies, but anyway, it gives you an idea that there might be something there. And those people, for example, who ate dark chocolate 5 or more times a week had a 21% reduced chance of diabetes. Okay. So we've talked about now some strategies to help us reduce stress on a physical level. So now let's talk about strategies to reduce stress on a mental level. So is your glass half empty or is it half full? Positive thinking in our attitude is very important is a very important stress management tool. Not only can it decrease distress, it may lessen pain, decrease the chance of depression, improve cardiovascular health, reduce the chance of cancer and other benefits. And let's face it, when you're around a person who's positive, we want to be around them. We don't want to be around negative individuals. So our feelings and our behavior are often a result of our thoughts. If we could change our thoughts, we can change our feelings and behavior. This is the basic underlying principle of cognitive behavioral therapy, one of the most popular therapeutic approaches to treat various conditions, including anxiety and depression. Um, when we when we experience an event that disturbs us in some way, we experience negative self-talk, which are called automatic thoughts in CBT parlance. These negative thoughts result in negative feelings, which causes more negative thoughts, and, and a vicious cycle ensues, which may lead to anxiety and depression. A technique I often share with patients is called the catch it, check it, and change it technique. You too can use this simple technique when something is disturbing you. Let me give you an example. Say your manager sends you an email in the morning saying she wants to meet with you later in the afternoon. Now, you may, getting that email, you may suddenly feel worried and anxious. I would. Why does she want to meet with me? This event may lead to a number of automatic thoughts like, I bet I did something wrong, or even extreme thoughts like, I hate my job. Automatic thoughts are frequently irrational. Our job is to catch them, like we just caught these two thoughts, and then to check, excuse me, to check them to see if they're rational, and if they're not rational, to change them into more rational thought. So in this example that I gave you, I might change the thought. I bet I did something wrong too. I might have done something wrong, but I can usually patch things up with my manager. And for example, the thought, I hate my job, you might be, a more rational kind of thought response to that would be, I might not like everything about my job, but there are many things I do like. So changing irrational thoughts to more rational, realistic thoughts will also change how you feel. This slide says, when I is replaced with we, illness becomes wellness. So we can experience both physiological and mental health benefits through social support, including feeling less stressed, less anxious, less depressed. We can support each other in many ways. You don't have to be very sociable or outgoing person to support someone. Let's take an example of different kinds of support for somebody who may be experiencing an illness. There's emotional support. For example, you seem worried, John. Let's say that the person has been just diagnosed with some kind of a cancer, and you can say to your friend, let's say his name is John, I'm very sorry to hear that, John. Is there something I can help you with? There could be informational support, like my wife was diagnosed with colon cancer, the kind of cancer you said you have, and she was really lucky to find a good surgeon. If you want, I can certainly give you his name and contact. these kinds of things, tangible supports, like being able to offer rides to somebody, to go to appointments, or maybe just belonging support, like saying to somebody, a friend who's just going through some difficulty, hey, if you want to go out to movie or the weekend, I'm available. That kind of a thing. Okay. The stress can activate our sympathetic nervous system, the fight or flight system of response, leading to increased heart rate, increased blood pressure, etc. And we talked about the parasympathetic rest and digest system. So which does the opposite, slowing our heart, breathing, etc., makes us feel more relaxed. Dr. Herbert Benson, a Harvard cardiologist, coined the term relaxation response for this phenomenon. Meditation is one way to evoke the relaxation response. Like exercise, the full benefits come with regular practice. Gradually increase the time you meditate, shooting for maybe 15, 20 minutes, once in the morning and once in the evening. And again, you can start very slowly by just 5 minutes a day, just like you can start any kind of exercise program slowly. There are actual changes in the brain that take place with meditation. The areas for emotional regulation and learning and memory increase in volume. There are numerous benefits from a regular practice of meditation. For example, improvement in anxiety, depression, sleep, pain, and others. So this slide says, today I will live in the moment, unless the moment is unpleasant, in which case I will eat a cookie. So we talked about meditation just briefly now. Let's talk about mindfulness. What is mindfulness? Mindfulness is awareness, the opposite of forgetfulness. Even when we do not make the time for a sitting mindfulness meditation, we can bring mindful awareness in our activities. For example, mindfully driving to work, mindfully eating your lunch, mindfully listening to a coworker. For example, eating lunch mindfully is an entirely different experience from the way mindlessly we usually gobble down food, often looking at, emails or looking at our phone for any messages, scrolling, etc. So savoring small bites of food, feeling the texture, the color, etc., chewing the food slowly is a very different experience. That's mindful eating. So we can bring that kind of mindfulness to many different activities. Um, Mindfulness, like meditation, has numerous benefits, including helping us manage stress. Okay, so I'd like to take you through a short mindfulness meditation exercise. Mindfulness meditation is the practice of paying attention to the present moment with non-judgmental awareness. It is probably the most common practice of meditation today. And one advantage of this is that it can be learned rather easily, like we're going to do today, without formal teacher instruction. Many of you may be familiar with it or similar techniques, but it's always nice to be able to refresh ourselves and refamiliarize ourselves with it. So what I'm going to do now is go through a short 10-minute or so mindfulness meditation, guided meditation. And so if you're ready, I just want you now begin by sitting comfortably in your chair with a relaxed but upright posture. So I'm going to guide you through this, okay? Feet flat on the floor and your hands resting gently in your lap. Notice, notice the support of the chair on your back and the support of the floor beneath your feet. You may gently close your eyes, or if you prefer, you can keep them half open with a soft downward gaze. Now begin to notice your breathing. Notice how the belly gently rises and falls with the breath, or notice the air moving in and out of your nostrils. You may become aware of the sounds around you or notice bodily sensations. Following the breath brings about a natural relaxation response. Breathing in, I am calm. Breathing out, I relax. Much of our suffering is due to thinking about past regrets and future worries. When we breathe consciously, we stop the thinking. We become alive to the present moment, which is the only thing that exists. Thoughts come in and out of your awareness. This is natural. When you notice thoughts, let them float by like clouds in the sky and gently coax your mind back to the breathing. There is nothing you need to accomplish right now, but to simply observe your breath. Where is your mind right now? Bring it back to your breathing. Breathing in, I experience myself breathing in. Breathing out, I experience myself breathing out. By consciously bringing awareness to your breathing, you bring yourself into the present moment, which is where you are right now. Breathing in, I am calm. Breathing out, I relax. Enjoy this peace. You may now take one or two deep breaths if you like. As we bring an end to this meditation exercise, you may find yourself becoming aware of the sounds around you and the sensations in your body. Now gently open your eyes if they were closed. Okay, okay. So we've covered a fair bit of ground today. We define what stress is and how the body responds to stress on both a physical and mental level. We reviewed various evidence-based and evidence-informed strategies for reducing the stress on our body and our mind. We learned ways to reduce acute stress in the moment with deep breathing, box breathing, and the five senses grounding technique. We then reviewed strategies to reduce chronic stress from sleep to exercise, from yoga to mindfulness and meditation, um, from an anti-inflammatory diet to dealing with automatic negative thoughts. So, which of these will you put in your stress reduction toolbox? And more importantly, which of these will you put into practice for a less stressed and happier you? So, often people have the thought is that when should I see a mental health specialist? You know, our mental health can change over time depending on many factors. When the demands placed upon a person exceed their resources and coping abilities, their mental health can be impacted. For example, if somebody's working long hours, caring for a relative with illness or dementia, or experiencing economic hardship, they may experience a deterioration in their mental health. There are some warning signs which may identify when you might be struggling with mental health issues and the time to seek help. If you're experiencing severe or distressing symptoms that last for 2 or more weeks, such as difficulty sleeping, changes in your appetite, weight, difficulty motivating yourself, getting out of bed in the morning, difficulty concentrating, loss of interest, difficulty completing things, um, feelings of irritability, frustration, constant worry about things, panic or anxiety attacks, all these could be potentially signs that you may need to seek some professional help. Okay, Thank you. That's the end of my presentation. I've really appreciated your attention today, especially later in the evening. So thank you for joining.
Thank you very much, Dr. Vyas. Wonderful presentation. I'm feeling very relaxed from the exercise. I hope other people are as well. We will take questions now. I did want to remind people, in case you have to leave, that I did put the evaluation survey. It says Survey Monkey link in the chat box. Again, if you could kindly complete that, I'd really appreciate it. As I said, I get suggestions for future programs for it. I also want to hear what you thought of the program. And it's pretty brief, so that would be great. I will stay on so you can complete it. Also, I put on the recording link because we're recording tonight if you want to review it once it gets posted, which will be about a week or two from now. So we did have, looks like 45 people. We got people even last minute that came in, so it's a good crowd tonight. And we do have some questions. Dr. Vyas, do you want me to read or do you want to read them? What?
Can you read them? I'm
Sure.
not seeing them. Yes.
Okay. Let's go here. If I do deep breathing exercises, I feel lightheaded. Please comment on this condition.
Okay. So the thing is that sometimes people feel lightheaded because they may be breathing deeply, but also if you're breathing too fast. So slow down the rate of your breathing, of your deep breathing. Try that. You may find that that decreases the chance of you feeling kind of dizzy. So you don't want to be overdoing it. And again, take things at your own pace. And I think that'll be helpful for you.
Another one, I have very bad anxiety, OCD, GAD, PTSD, SAD, and now I was just diagnosed with memory cognitive problems, and I have insomnia too. I guess suggestions.
Well, the thing is that the good news is that, you know, you can have a host of different conditions, but at the end of the day, it's your functioning that determines how happy you are and how functional you are in the things that you have to do at work, at home, in your relationship. So I have people that have, if I were to give diagnosis, a number of conditions, but they come and they see me and they seem, oh my gosh, they don't even seem like they belong in the office, right? And they're doing quite well. And there are other people that really have no real kind of diagnosis or anything like that, but are really pretty unhappy, having difficulty coping. So, um, with those different conditions that you have, the good news is that there's none of those conditions are ones that we can't help you with, and that we can make better, and that you, with the guidance of a good therapist, um, um, psychiatrist or psychiatric nurse practitioner, you can make a lot of headway with those things. So that's the good news, despite those things that you might be encountering.
How can older men with BPH who need to get up several times a night get 7 hours of uninterrupted sleep?
Right. Well, the thing is that, uh, getting up a couple of times or even several times at night is not uncommon as people age, right? Men and women. So the thing is that, um, first of all, if you have a urologist, talk to them because they may be able to help you with that nocturia, that nighttime need to go to the bathroom. So that will be one thing that you could do. The other thing is that you might want to just, one of the important things, I find that there are people that get up several times a night, but they fall back to sleep pretty easily or in a relatively short time. It's the people that get up and then can't go back to sleep are the ones who always complain to me. So the thing is that there are certain techniques that can be used to help you fall back to sleep faster. We don't have time to go over that, but there are the American Academy of Medicine. The number one technique for insomnia issues is the cognitive behavioral therapy for insomnia. So ask your therapist if they're familiar with it, look those things up, and that might help you.
We have a comment, how much somebody loves Capitol Health and the doctors there. Thank you. We have a thank you so much for the wonderful presentation and conversation. So important and helpful. Another thank you. I loved it. Another thank you. Thank you. Will this meeting replay? Yes, so I have the recording link in there. I can post it just in case, again, just in case you came on after I copied it. So I will do that. Another thank you. What was the phone number at the very end?
I can
Does
give you
Capitol
that.
Health have their own mental health specialist?
Yeah, so the phone number is 609 689 5725.
And yes, you do have mental health specialists. Um, Does this doctor accept my medical insurance, United Healthcare, Community Plans of New Jersey?
Well, I tell everybody that I'm not the expert with the insurance, so you can call our office and our front office staff can definitely handle that question as to whether you are in network with us or not.
Great presentation. Your voice is very calming. How does drinking coffee impact stress levels?
Well, the thing is coffee and tea have the polyphenols, which actually decreases inflammation, which is then um, we talked about that whole part about how inflammation and stress are related. So that's how it's believed to be helpful.
Thank you, doctor, and thank you to the lady who's talking. That's me, I guess. Thank you. So that's all the questions that I have. Let's see. Does Capital Health have meditation classes? I know we have a wellness center. I'm not sure if they offer to the community. Do you know, doctor, whether we
Yeah,
have
well, I know
meditation
that
classes?
we do have things for the employees, like we have the kind of the
Yeah,
thing that was happening, for example, at like lunchtime and things like that. We
right.
do from time to time, I know that some of our therapists also um, give classes and things like that. So I don't know if there's one currently right now.
Okay. Person asked so they can call the number that you gave about the insurances. That's correct, right?
Yes.
Okay. Um, we also have a sleep center. We do have a sleep center. It's in Hamilton, Capital Health at Hamilton Sleep Center. Does this help people that have FND? Do you treat that? FND, doctor? I'm not sure what that is.
Um, I'm not sure myself. Can that person kind of elaborate?
Um, let's see if I can
Is it
find.
is that are you talking about FTD, frontotemporal dementia?
Um,
I don't know.
let's see if
FND.
I can unmute this one person. Yes, the sleep center is on White Horse. It's actually White Horse Mercerville. Let me see if I can unmute this person. Oh, functional neurological disorder.
Oh, okay. So, um, can the things we talked about today help with that? Absolutely. The thing is that functional neurological disorders often have a stress component to them. And so that uh, when you are experiencing less stress, that can actually positively impact that disorder. Yes.
Okay, thank you very much. I think that's it for questions. Um, so I will thank the doctor again. Wonderful
Mhm.
job. Thank you to everyone for coming tonight. We had a really nice turnout. Again, the recording will be posted in a week or two, so you're welcome to use that link and view it again. I will stay around for so people have a chance to complete the evaluation survey. It's the link that says Survey Monkey. And again, if you can kindly complete that, that would be great. I'll stay around for another 5 or 10 minutes, so you'll have a chance to do that. Um, will you have another one of these? We do offer stress programs usually at least once a year. Here, thank you. Okay, so thank you very much, doctor. If you'd like, you're welcome to leave. Another thank you. Um,
Yes.
and I will wait around. Hopefully people will complete the survey.
Right.
So
Well,
thank you, everyone.
thank you all for attending. It was my pleasure. Everybody have a good evening.
Thank you.